virtual corporate track workshop, Navigating, Sourcing, and Procurement in the New Normal. I am Anne Marie Wallace, Senior System Community Engagement Coordinator for Baptist Memorial Healthcare, and I'm pleased to introduce your workshop speakers, Christin Webb and Camille Thomas. Christin Webb is a certified professional public buyer with 10 years combined management and organizational contract and procurement experience. She is an administrator of purchasing for Shelby County government, where she is responsible for overseeing all activities involving the county goods and services procurement processes. Before joining Shelby County, she was procurement professional with Federal Express Services and Memphis Light Gas and Water Division. She is the Vice President of the Tennessee Association of Public Purchasing and Talent Council member for NIGP, the Institute for Public Procurement. Christin is passionate about serving her community, not only through government procurement, but also as she serves as commissioner with the City of Memphis's Youth Guidance Commission. Christin graduated with a Bachelor's of Arts from the University of Memphis and a Master's of Business Administration from Webster University. She is a native Memphian. Welcome, Christin, and thank you for joining us. We also have joining us today, Camille Thomas. Camille is the purchasing director for the City of Clarksville. She has worked in the department since 1996, seated in every position offered in the department. She has served in various roles for the Tennessee Association of Public Purchasing, TAP, to include membership chair, secretary, vice president, and now president. Prior to working for the City of Clarksville, she was licensed to sell insurance for State Farm Insurance. Welcome, Camille, and thank you for joining us. At this time, I'm going to turn the session over to Christin to start it. Thank you, ladies.
Awesome, awesome. Thank you for having us. Thank you for that introduction as well. You make me sound more fabulous than I am, so I appreciate that, and I enjoyed hearing more about Camille. So very glad to be here. This is Navigating Sourcing and Procurement in the New Normal, and Camille and I hope to just kind of have a conversation today. We have these slides that are going to kind of guide us, but what we're hoping really is to have a conversation around our experiences, specifically in government procurement, and the impact that the pandemic has had on sourcing and procurement for our organizations, as well as those that we have maybe garnered information from our cohorts across the state, and maybe in other conversations through the NIGP channel. So I won't reintroduce us, but when I thought about, or when we think about the transition to the new normal, I think it's a great way to look at it in 3 phases. We had the react, reassess, and a rebuild phase that we'll go through. So in the react phase, phase 1, that's really where we were just trying to react, right, Camille? All the bells and whistles were going off, all the alarms, all the various departments and agencies that we support were needing PPE, they were needing other types of materials, and we just saw just this emergency response that we were being reactive instead of proactive, which is what we really like to be in procurement, right? We want to be proactive and really be able to plan and execute accordingly. So in that react, we were just being rapidly responsive to emergencies and just providing that immediate relief to reduce harm or disruption to our communities that we serve. Would you like to share anything else on that, Camille?
I agree with you 100%. It was a learning curve, a lesson for sure, on how to prepare for the next, whatever it would be. I don't know about you, Christin, but our entity has talked about this for years, and then it happened. And now we're having to react and try to find everything that we can to provide for employees' safety and the safety of the community. and where to get it, basically. So yeah, completely agree.
Absolutely, absolutely. So, you know, we couldn't really plan for it. Like you said, Camille, we talked about it. I'm sure most agencies talk about disaster recovery or talk about continuity and business plans of that nature. But, you know, how often do we actually have them in place? And even if we have them in place, how often do we get an opportunity to test them? So, you know, the pandemic, for those who had disaster recoveries, we may have had an opportunity to test it out, you know, and then in others, maybe not. And so we were having to be very reactive because, as we all know, COVID-19 was not, it was nothing anybody had ever experienced it.
Mhm.
So on reassessment, this is the phase where we kind of got an opportunity to really start gaining a better understanding of what was happening around us, specifically with demand, with the supply market, and how we needed to be responsive, maybe being more familiar with our vendor base and their availability of resources. So we just had we started gaining a clearer understanding of the consequences and the impact from the global pandemic. We were able to start adjusting our procurement infrastructures and strategies so that we could begin to face those new challenges. And then our emergency responses actually continue, right? So even 4, 5, 6, 7, 8 months in, you know, we were still responding to emergencies. Our policies, we were able to, in the reassess phase, I believe that's when we started to really kind of hone in on our policies to see what needed to be changed, if anything. How about you all, Camille?
Yes, definitely.
Okay.
I put together a policy specific to these kind of things. Clarksville has been hit with more than just a pandemic. We've had a massive tornado come through in '99. We had the Great Flood of 2010, which I'm sure everyone saw on television if you watched television in Tennessee. So, but this was different. This one, we didn't want anybody in the building. So now how are we going to do some bid openings, things like that. So we had to read everything that we were doing, how we were going to do it, and was it legal to do it that way? Even though we were in this situation, could we do it that way? I'm sure you, along with me, were reaching out to anybody and everybody for guidance. What are you doing? About how you're doing it, and then you try to think about how it's going to fit into what you could do where you are. So it was different.
Absolutely. And I agree with you when you mentioned, you know, the collaboration. That's what I heard, you know, us having to reach out and depend more on legal to get guidance on what we could and couldn't do. Or even with our governing boards, what would they, you know, approve for us to change? And then, you know, obviously we'll talk about some other things we had to do in partnerships and building relationships and collaborating with suppliers as well. But definitely in the reassess phase, the collaborations, the reassessment of policies, and things of that nature, our infrastructure, super important as we continue in the pandemic. And I will say these 3 phases, they can overlap. It's not that they happen, you know, in sequence. You know, while we were obviously reacting, we still, you know, we're reassessing. So there is going to be some overlap in that process because we're still doing it. We're reassessing, but I also feel like we are moving closer to that 3rd phase, which is what this whole entire conversation about, which is the new normal. And so I consider the new normal, I looked at it as like rebuilding. We're having to rebuild ourselves. I guess I'll even say knock off some of the dust from what the beginning of the pandemic, you know, created for us so that we could be more efficient in our processes and really be strategic in the way we carried out our procurement. So in phase 3, in that rebuild phase, as we move into that, we started again shifting our focus towards recovery, policies, addressing consequences that we may have come into. And then as we slowly return to normal, our emergency responses became more minimal. I like to think they do anyway. And then building on the strategic role that public procurement can play in the recovery. And I put that one there because it was really awing to see how our departments and different agencies really began to see the value add in procurement. what's his name? Rick Graham, our NIGP CEO, he likes to say, you know, when a pandemic happens, when there's a scare, there's an alarm, purchasing or procurement is very important. Then after that, you know, they're just kind of by the wayside. But I think the pandemic absolutely presented the opportunity for procurement to really show its force and the strength and value that it brings to not just the organizations we serve, but the public as well. So I feel like we're in the new normal. So what does the new normal look like for us? And we've identified a few items that we want to just go through today, maybe talk about what has happened within our agencies as well. So we're going to kind of go over crisis management, purchasing organizational value add, as I kind of touched on, supplier engagement, cooperative contracting and piggybacking, automation and innovation, local business. How does that play into the new normal from a procurement perspective? And then supply chain awareness. And this doesn't have to be in any specific order. So I do want to put that disclaimer out there. So crisis management, it was us making sure that we ensured, or we're having to make sure that we ensure we have documented and tested processes in place to be able to respond to not just pandemics, you know, not just another COVID, but any type of crisis that happens. I mentioned earlier, we did not necessarily have a documented disaster recovery. We're very manual where we are. So we had to really think about what resources, what technologies, what processes and changes we may have need to make to be able to be responsive in an alternative working or remote situation. So what about you with your crisis management and how you all handled that?
Well, the
or are handling?
Yeah. First thing was each department was contacted and asked to send people home. Well, that's great, but how are they supposed to work? You can go home and use your personal computer, but you're not going to connect into our financial software. You're not going to connect into our time-keeping software. You're just going to send emails. You know, that's what we're going to do. So we had to come up with a way to allow home computers to access these very important software systems, which can make you vulnerable. So temporarily that happened. And then we bought laptops and put that software on there and then sent people home with the laptops. So that way our systems are not vulnerable. You know, you had to do that. You had to work from home. I never did. Somebody kind of had to be here, unfortunately. Probably for you too.
There's my hand. I was like, you couldn't see my hand, but I'm right with you, Camille. Yeah. I had to be present. Yeah.
I don't think it was going to work if everyone went home. Somebody needed to be there. There's still things that have to be hard copied or hand delivered or something to that effect. But if you're like me, I think I was one of 2 to 3 people in the entire building for months. But you had to do what you had to do, and you had to keep going. That also meant, how are we going to open a bid? So you had to come up with that kind of a situation. How are those vendors going to give you those bids? If you don't have it in your policy for emailed bids, they still got to give you a hard copy. So how are you going to manage that? How are you going to manage any shipments? Because now you're buying all this PPE and no one's in your building, you know, except you and the mayor. So how is it going to get to you? It was a lot to process at the time. I'm so sorry.
That's okay.
I didn't tell people I was in a meeting, but it's a lot to process, and you have to come up with what's going to work for your entity, for your business, for whatever it is that you do in life. You just got to figure it out, and honestly, I think we still are in a little
right.
Yeah.
Right. And I like that the last part you said. I agree, Camille, because it looks different for every organization, right?
Yes.
So for your organization, you know, smaller organization, and the level of presence was probably more required than maybe more automation for a larger organization possibly, but definitely it looks different for every organization. And as you're going through crisis management, you're looking at your disaster recovery, you're looking at your communication plans, and really trying to identify all of the stakeholders and how your work or the procurement work we do impacted them, and how could we be responsive accordingly, and then document it all. Like that was the key part. So I can say today we have it documented, and heaven forbid there's not, there's another pandemic. But I think we'll be in a better position to be able to be responsive to it because of that. So definitely crisis management is something that we continue to work through, but I think the experiences that we have had throughout the pandemic has prepared us for the future. Absolutely. So then when I mentioned earlier about purchase organization value add, I absolutely love this piece because obviously I take pride in procurement, government procurement, and I think it's important that our users, our public understand the value we bring. And I think the pandemic absolutely did that. We were able to identify supply for our users. So we are a hybrid model of a procurement entity. And so our users, they do some of their own sourcing, and then we also facilitate those larger projects for them. But a lot of times they found themselves at an impasse. They weren't able to find the suppliers that were needed for things that they wanted to procure. And previously, they may not have been as reliant on us, and they started to look at us for us to use our resources. So it may have been me picking up a phone and maybe calling Camille or calling down the street to some other municipal organizations to see if they, do you have a lead on this particular widget? Because my team needs it, or someone in-house. So I appreciated that we were able to show our organization how much value, how we can offer solutions as opposed to creating these impeding processes that they feel like exist. And so we were able to offer that. And then again, just offering that guidance, being a solution-oriented entity, and the organization seeing that and feeling the value from it. How about your organization, Camille?
Much of the same. And I want to also stress that Christin and I are both part of the same professional organization, and the emails that started floating around right when it started. Do y'all have a source for this? Do you have a source for that? How can I find this product? Without that method of networking between our members, I don't know that I would have been as successful in finding specifically masks. That was very difficult in the beginning. So, and again, as Christin said, your departments are looking to you. It was on the purchasing department's shoulders to acquire whatever PPE was necessary for all departments. So whether that be the sanitizer or the Tyvek suit things, because we do have people that do inspections inside homes, things like that. It was nice to know that others were doing the exact same thing we were and had some success in one area, but maybe not another, and we could help each other. So, yeah. You're on mute.
I'm sorry. As you were talking, you made me think about, in essence, I feel like there was, for us, there was this cultural and behavioral change internally, yes, which I think is going to hopefully be long lasting going forward. So definitely procurement, purchasing, obviously rose to the occasion in most all organizations, and the organizations see how we bring value to what it is they do and how much they truly need purchasing so that they can carry out their operations. So supplier engagement, I listed that one because I think it's really important that as we continue in the new normal, that we are truly working on building new supplier relationships and even maintaining, I shouldn't even say building new supplier, but actually maintaining the supplier relationships and partnerships that we have. The pandemic showed us that we needed our suppliers. They were the pulse to the market to let us know what they could and could not get access to, how long lead times would be on items, which would give us guidance on any other strategies we need to take. But I also think it's important that we diversify our supplier base. So going forward, making sure that we have multiple sources to find items. There are some things that are very customized a lot of times in procurement or specialized, and the market may be small, but definitely diversification of our supplier base and engaging suppliers in events like this, having suppliers be able to have access to us and making ourselves available and reaching out to suppliers so that we can make sure those relationships exist for the success of the organization. What about you, Camille?
Something else, you have to think outside the box as well.
Mm-hmm.
For instance, just because certain types of vendors carry a certain type of product doesn't mean that's your only source. When we had several departments wanting the gloves, again, we have people opening mail, inspecting homes. I went to Sally's Beauty Supply. I went to pharmacies to get those gloves. Those are locals, you sometimes thinking outside the box got you what you needed when you needed it. And I personally enjoyed learning from these new businesses that I've never done business with in a professional level. Let's put it that way.
Right.
So it was really nice to engage with some of those folks and show them how important it was that what they offered is something that we can purchase. And I know you're going to go over, but I thought that was very important. You sometimes have to think outside the box and find something else that fits your needs that you can get somewhere else because they have it.
Yeah.
It's right there. It's on their shelf.
Yeah.
No one's thinking.
Right. And you expanded your supplier base just from that.
Definitely.
So that was what was awesome. I heard in that example. I didn't have to go out and hit the pavement. I wish I would have had to, get out the office and hit the pavement a little bit, but I definitely hear that innovation and that creativity, which a lot of times in procurement, we don't consider procurement to be creative because you've got these rules, you've got these regulations telling you exactly what you can and can't do. But the pandemic, and I probably should have added that as one of the things, I did add innovation, but it allowed us to be more creative in ways that we hadn't been before. And I definitely hear it in our supplier engagement as we move forward, just thinking outside the box, like you said, Camille, being willing to get outside of our comfort zones and really bring suppliers to us and go to the suppliers so that we can get what we need. And then obviously helping to build those suppliers as well. So cooperative contracting and piggybacking for us became helpful because it did cut out some of the inefficiencies that can come from just the normal bidding process, right? And in a pandemic, you're just trying to be responsive. You need to get things as quickly as possible. And so those intergovernmental partnerships, for us specifically, we did a lot of piggybacking, or more than we had previously, where we found other contracts that maybe the state had. And if the material was available, I'll say that, we were able to piggyback off of those contracts so that we could be responsive and didn't have to spend so much time on trying to competitively bid items that everybody was everybody out there was competing for. So we can move a little faster in that way. And then also leveraging the spend, obviously. What about you, Camille? Did you all take part in that?
Oh yes. That was where we found the masks, was through because of networking with our organization, finding out that someone else was able to find it through a particular company that was on the Omnia Partners. Hopefully I can say that, but was nice. I immediately reached out and was able to get at least what we needed for the time being. And then unfortunately the supply kind of stopped and we had to look, but at least we have what we needed to get us started. So we definitely use cooperatives.
And it's something for us. We didn't piggyback often before the pandemic, and I definitely see it. I had someone come to my office just earlier today asking, hey, I found a state of Tennessee contract on something they need. And before the pandemic, that probably wouldn't have been a conversation on the table at all. Even though our policy supports it, we were just very heavy about moving towards competitive bidding. So definitely the piggybacking is a part of our new normal. It's definitely a value add where it's applicable, and we look forward to continue using it so that we can be efficient. So automation and innovation, we've touched on some of this a little bit with some of the examples we've given, but for me, the new technology piece is really, I don't know, I'm passionate about it because I've been in a couple organizations where we were very automated in some ways. And had technologies that we did a lot of our bid processing with. And this pandemic really opened our eyes to seeing how we needed to be more efficient as relates to technology. We are actually in the process of exploring a new ERP system. And I think it's going to be heavily supported because of the experiences that we had throughout the pandemic. And so those new technologies, we're looking forward to our new normal, having more operational continuity and efficiency, even being able to capture our spend analysis in a more effective way. Being able to have that real-time data, being able to know exactly from purchase order to pay, where are we in the process of our spend and capturing, even if we're trying to capture local spend. I think the new technology is definitely going to put us on the right track, as well as allow us to be able to see where there's some saving opportunities that currently we're not able to do as quickly as we would like to. But I know the pandemic absolutely lend that that opportunity or to happen. I think it's definitely going to take place going forward. It's going to be supported because the pandemic happened and it opened our eyes. So that'll be our new normal. And then obviously the virtual operations, the pre-bid meetings, the public bid openings. You can never tell me that we were going to open bids strictly by phone or strictly by Zoom or GoToMeeting, whatever the preference was. But now it's the new normal. And to your point, Camille, earlier, we had to pull in legal, and say, hey, legal, is this okay for us to do? When you're doing something you never done before, you want to make sure it's okay to continue it. So those things, we're not getting away from it. While we are in rebuild mode or the new normal, COVID still exists. Where I am here in Shelby County, we're talking about numbers that are starting to look differently than they did 2 months ago. And so we don't want to shy away from that, as well as it's made it very convenient and helpful for our suppliers to be able to access us. And we're actually expanding our supplier base in that way. When you think about how now they can just jump on a call, and still send us our paperwork with the bid, and they don't have to miss a mandatory pre-bid because it used to be in person. So that's my spiel on automation and innovation. What's been your experience in the new normal?
Well, I already kind of talked about some of it was, buying these laptops so employees can go home and work from home. And honestly, that's not really going to stop for some people. It's going to be allowed for some people, not necessarily everyone, because everyone can't do that. But, and I'm not saying every single day. I still have employees that stay home a couple of days a week. But and that's fine. We're still working. We're getting it done. The pre-bid meetings for us, most of them have started going back to in person, but they've usually been on a construction project, so they're outside. But allowing those to be virtual has allowed more vendors to bid, which is nice. You want vendors to bid. So having those mandatory pre-bid meetings, either allowing someone to call in or seeing it virtually, has been a blessing in our projects, because we have a lot going on for, we're not as big as Memphis, but we're fifth in the state. So yeah. And the public bid openings, we're still doing virtual. There's no reason not to. There's no reason not to. I don't have to have a contractor come off the job, come in the building because they want to see what the prices are. They can sit in their truck and listen to it and just watch me open it. So it's been very nice. Very nice.
Yes, it has efficiency, supplier engagement. We talked about that. That's what that's lending to. So I definitely think automation and innovation and just continued exploration of that. Like, we're looking at the ERP system now, but there may be other things that come forward down the line that we may be more likely to look at and take a closer look at it than before, and maybe not so reserved in that way. So, and allowing our budgets to satisfy that as well. Let me throw that out there. Yeah, so definitely automation and innovation is a part of the new normal. at the very forefront. I added local business, and Camille, you gave like a perfect example of having to hit the pavement to go to a local business. So just having those more intentional connections to build those relationships. And then for my entity, I know we focus a lot and we have policy driven around the locally owned small businesses. And so definitely our new normal is going to push us to really hone in on that policy more. And then the pandemic just showed us that our local guys, our local businesses, they could provide what we needed sometimes sooner than maybe someone we'd been buying something from out of the local area. So definitely going forward, local business is very high priority for us, and I believe it's not going away. How about you, Camille?
And you're supporting local businesses.
Absolutely.
They were hurting too. So knowing that you can reach out to a local business and get the product you need, pretty much every time I needed it, it was there, whether it be at one location or another. There's always going to be more than one pharmacy or more than one Sally's Beauty Supply or whatever it was. You know you're helping someone else as well that needed it as well. I mean, they had to send employees home too.
Right.
So yeah.
And I think other entities, and obviously I'm more aligned with the governmental side, but I definitely think the new normal is going to require governmental procurement to really start to hone in on those local businesses much more than before, because we can't go without. We learned that in the pandemic. So, and this maybe could have gone first, but being aware of the supply chain of the market. A lot of times in procurement, I think we're just, we're tussling and moving paper and just getting it done. And it can be a lot sometimes to kind of just stop and see what's going on with the market. What raw materials are being impacted to get us the product we're looking for, and just being aware of that. So for us, I definitely saw an increase in us having to be aware of what was happening in the market. For us to be aware that, in China, I'm just throwing out something. In China, there's some blockage in getting things over here to the US or something of those, something like that we didn't always pay attention to, right? And so I think that's obviously a piece that's important. And then just trying to forecast cost. I think most procurement professionals have seen increases in a lot of products, a lot of things, and a lot of services as well that we are providing. When you talk about construction, I mean, everything down to styrofoam cups, we've seen increases. And that's been important for us to pay attention to as we move into our contracting and our bidding processes. Right now, what is our cap that we accept for increases? And so we run into sometimes where we're not able to continue with the contract because there's been an escalation presented by the vendor, and we're not able to support it based on the way the bid was written or the contract was written. So making sure that we're able to create bidding opportunities or contracting language that allows that flexibility, so we can maybe accept some of the changes in the market as it pertains to cost. We're not going to always be able to do it, but I think it opens our eyes to maybe really evaluate how we structure our bids, how we structure the terms and the renewals and things of that nature, so that we can make sure we're able to absorb the cost if we can, just so we can have that continuity. So that's been kind of major for us. We've run into a lot of increases in costs, and we want to make sure that we're able to navigate it. How about you, Camille?
Well, the way I look at it is this. What happened in the grocery stores with toilet paper, hand sanitizer, disinfectants is happening to governments with their products that they need to continue to provide service or to fix the water leak in the street. Products are in short demand as well. We have had problems with trying to get an annual contract, which we've never had problems with, because they can't hold their price or can't give us the product for 6 months. That's never happened.
Yeah.
Never happened. So we're now having to rethink how we do this process. If a vendor says, if I bid out a product and the vendor says the price is good for 60 days and you better order it, we're going to take the lowest price and order as much as we can within that 60 days. So we know we're going to get that product because we don't know if we're going to get it afterwards. That has been a real challenge
Yeah.
Because a government is here to provide a service to the citizens, and you still have to provide it somehow, some way. And you need whatever that is, so you can continue to fix what happens in the street, or what happens in some sort of water line that goes up to your meter, or whatever that is. The light fixture that shines over your street. If we can't get that, the citizens are not going to be happy. So we have to try and navigate how we're going to provide that.
Yeah.
At least right now, I hope that this all settles down soon, although I don't think it will. I think it'll be next year at the very earliest, and we can go back to some sort of normalcy with not only the pricing, but just getting the product. Just getting the product. That's our biggest challenge.
Lead times
here.
are crazy. Yeah, lead times are crazy. Meeting those lead times. For us, one thing that I think we're going to start considering is maybe our contracts need to be on shorter terms, so that we can better forecast and really capture and stay within our budgets, and things of that nature, which usually, we like to do multi-year contracts because it's supposed to be efficient. We're not supposed to have to come back and revisit and redo, the whole process over again for years to come. But I think those shorter contracting terms are going to be more important. Hopefully in the short term, like you're saying, maybe just until next year, Camille, but definitely want to have those shorter contract terms so that we can stay ahead of the market, if there's such a thing. So definitely supply chain awareness. And so that kind of brings us to the end of our presentation. These are just some of the points and experiences that we've had at Shelby County government or at the city of Clarksville, and as well as in talking to some of our cohorts across the state through Tennessee Association of Public Purchasing and NIGP. So with that, if anyone has any questions, we definitely offer that opportunity at this time. I think I saw Mark has put in the chat. If anybody has any questions, feel free to put it in the chat or I guess that's where you have to put it in the chat. That's all I have. Thank you. That's all we have. Thank you.
Appreciate your time.
Absolutely.